Well, thank you very much, everybody. Welcome to Think Tank. Rory is joining now here as well. We have the privilege to have Dr. Okker here describe and explain the intricacies behind a modality that is just, I think, underappreciated in conventional medicine, but wholly appreciated in functional medicine. And hopefully with that increase of understanding that our group will have, we can broaden its utility into other fields through collaborative means of medicine as a whole. So welcome, Dr. Okker, and yeah, we're truly appreciative and very much so respectful of your knowledge, and just grateful to have you on board. So thank you.
Great. Very, very, very grateful for you for the opportunity and for the time. It's always great to chat to practitioners about live blood analysis. It is a wonderful tool, really fantastic. There's so much value that it offers in practice. And as you said, unfortunately, still not fully understood and not utilized, by practitioners, as it should be to its full potential. All right, so fantastic. Thank you, everyone, for joining us today. We are going to go through just the main points about what live blood analysis is. We'll have a few examples of the type of things that you can see in live blood samples, and we'll also discuss sort of how it integrates in natural health practice and integrative practices as well. All right, and then if there are any questions or issues along the way, please just ask, and we'll cover them as they come up. So the practice of live blood analysis, the technique itself actually involves the analysis of two types of samples. We take a sample for live blood analysis, and then there's a second sample that's collected for dry blood analysis. So they're just prepared slightly differently. And then the live sample is viewed under the microscope with two types of applications in microscopy. So what we're seeing on the screen now are basically those two types of applications, dark field microscopy on the left-hand side and bright field on the right. Now, it's quite interesting to note, if you look at the two, the images are from the same sample, and we can see far more on the, in the image on the left-hand side, in the dark field image, than the bright field image. Bright field microscopy is your sort of basic standard technique used in normal laboratories. So your normal laboratory microscopy would be a standard biological microscope that has a bright field sort of capabilities. Dark field microscopy is fairly niche. It's fairly limited. It's not being practiced widely, in the field of microscopy as a whole. There's some applications, for example, when examining pond water and things like that, where you use dark field microscopy, but really used in the way that it's used in live blood analysis quite uniquely. There's a specific set of requirements in a dark field microscope to kind of allow us to see all the things that we typically would see in dark fields. And you can see there's so much visible between the cells, like in the plasma there, that's not visible at all in the bright field image. So it's always very interesting to see, and clients always remark as well, when we go from bright field to dark field, they're always amazed at how much more they're able to see. It's almost as if the sample has come alive, so really, really beneficial. And through dark field microscopy, because of the way that the light travels through the sample, we're able to see all these fine, small, faint things that are not visible with standard bright field, in a way sort of staining the sample without having to preserve and kill the cells by applying some sort of chemical stain. We're able to stain the sample in principle then with light. So things that are invisible in bright field, where they would need to apply a stain to actually be able to differentiate between specific things like certain types of white blood cells, we're able to do quite easily with dark field. So the principles are, the technology is quite complex. The way that the light travels through the sample with dark field is quite different from bright field. This sort of image just illustrates that. Quite an interesting technique, and interestingly, it was actually developed towards the end of the 1800s. So something that has been around for a very, very long time. And the basic principles haven't really changed, although we've had improvements with, illumination, the light source of the microscope. So the LED sort of technology has improved, of course, and imaging has also improved greatly. So we have fantastic cameras now that we have connected to the microscope. The actual design of the dark field condenser hasn't really changed over the years. So what's quite striking with live blood analysis is what we're able to show clients. We have an image of what blood should ideally look like under normal circumstances, the image on the left there, and that also is in dark field. And there's various deviations from the norm then that we can pick up in samples. So always very interesting for clients to see this. It creates quite an impression, you know, when patients see their blood cells on the screen. It's obviously with a microscope displayed on a monitor that the clients are able to see, and it makes quite an impression on them to see their, you know, their ailing blood cells on the screen, and they immediately want to know what to do. They feel, you know, connected to it. They want to know what to do for their cells to improve the appearance of the picture. And then there's also, you know, looking at the difference between normal and abnormal. We can then track the progress during treatment to see whether things are actually improving by looking at whether the client's picture is essentially going back to more of a normal image. I mentioned dry blood analysis earlier. This is the dry blood sample. You can see it looks very different from the live blood sample. With live blood analysis, it's really done at very high magnification, where we're looking at the actual cells and their structure, whereas with dry blood analysis, we're actually looking at the way that the blood has dried on a slide. And that allows us to see various indicators of various underlying imbalances and health challenges. So also a very big difference here between the two images. And there's, of course, a lot that goes on in between these two extremes, from a normal picture to this abnormal image on the right-hand side. All right, so just a few images. I've got a video here as well, just showing you some of the things that we actually see with live blood analysis. And one of the greatest benefits is that it is an actual live sample. The blood has not been stained or altered in any way. So we're actually seeing the blood behave, the cells behave like they do in the body, you know, under normal conditions. And we see that the white blood cells behave like they normally do. So we can actually see all this movement taking place, these gray structures that are moving around like this. These are actually neutrophils, white blood cells. And we can actually see them working. This actually shows how this white blood cell is busy cleaning up issues with the red blood cell membrane here. So it's actually actively mopping up the terrain. And what we often work with, this sort of basic principle of live blood analysis, is that what we're seeing in the blood tells us about the condition of the internal terrain of the body. So not so much the signs and indicators for specific medical conditions, but rather imbalances taking place in the system that precede disease. So really helpful for us to actually track these things in practice. This is also a white blood cell, the bright structure in the sort of lower central area of the slide here. It's also a neutrophil, and this is then viewed with a dark field lens and with 100 times objective, so very high level of magnification, about 4,000 times magnified, and also live samples. So we're able to see all this activity taking place, all these changes, the cells behaving and doing what they normally do in the sample. So really valuable for us to see this, you know, as opposed to looking at a stained dead sample and working out, you know, dynamics of health and disease just based on what one can see from there. Right, so just another video, also dark field. So, you know, we do see more interesting things in dark field. So a lot of the time we spend in the analysis is actually spent in dark field. Let me pause it as well so I can actually point out these patterns as we go along. So some thrombocytes there with some fermentation patterns around them. These sort of things we tend to see when there's an overgrowth of candida or candida in the system, intestinal dysbiosis. These teardrop-shaped red blood cells also indicate poor protein digestion, so related to how efficiently the body deals with protein and metabolizes protein. Yeah, so the little pocket of fibrin there, these white lines, that's fibrin or fibrin that forms in the blood, and we use that as an indicator for liver stress, so very useful to track in cases where we actually have challenges with the liver. We can look at those and see whether things are actually improving. So we've summed up what the main benefits are of live blood analysis in practice, kind of give you an idea of how it actually integrates into a practice. So the types of imbalances that we are able to detect with live blood analysis are imbalances at the cellular level. We're also able to choose the best course of treatment based on what we've observed in the blood. Through monitoring the changes taking place in our client's samples, we can also then test and monitor the efficacy of the treatment that was given to the client. And then also based on what we're seeing in the blood and how it affects the client and what they're actually seeing, we're able to demonstrate the negative effects of an unhealthy diet and lifestyle. And also it creates a very interesting and dynamic, or an interesting dynamic rather, in your practice. So let's go through the points just briefly, and then we have some more examples towards the end, some more slides showing before and after images of clients with specific health problems that we worked with in practice, and basically managed to improve the condition of their blood as well as the condition that they were struggling with at the time. So it does allow us to detect imbalances at the cellular level. And these are imbalances that are really important for us, practitioners of integrative, functional or natural medicine. We work with these imbalances as we understand that, addressing those imbalances and correcting them will allow the body's own mechanisms to facilitate healing. And these because they are really instrumental often in the development of disease, and they sort of take they're going on in the background over many years before an actual diagnosis is made. These imbalances also then precede the onset of disease. So we're able to then detect these imbalances and track them in real time in the blood of our patients. So this gives us quite a powerful preventative medicine tool, because there are many imbalances and indicators that we're able to pick up in live blood samples that would precede medical tests. A good example that we often use is the indicator for liver stress that we see in dark field, those lines that we saw in the plasma there. Those are related to the release of fibrinogen by the liver, and quite a useful and accurate way to measure liver stress in clients. So often if we see severe patterns of fibrin in the plasma, the place we usually start is with liver detoxification and liver support. And as the liver improves, we see those patterns then also clearing up in our samples. Interesting though, if those clients who present with those patterns in their samples, if they are sent for conventional liver function tests, those tests usually come back completely normal. And that comes down to the difference really between live blood analysis and conventional blood tests. In conventional blood tests, the focus really is the diagnosis of disease. So imbalances will only really show up there once things have already progressed, once pathology has set in, and once a condition is developed where an actual diagnosis can be made. So those liver function tests, which I'm sure many of you would be aware of, are often enzymes that are released by liver cells, after lysis, after the cells actually died. So a much more later stage of liver stress than just fibrinogen being released into the blood. So being able to see all these things and show all these things to our clients also allows us to see and understand our client's state of health on a much deeper level. We work with the biological terrain. The principle, if you're not familiar with the biological terrain, the principle is similar to fish in a fish tank. If the water in the fish tank is not in the right type of balance, then the fish will become unhealthy and will become sick. But the treatment in that case is not to dispense and administer some sort of cocktail of medication, but to simply clean the water. And in the same sense, that is the biological terrain, the principle is the same. The fluids that bathe all the cells in the body is the biological terrain. And if the terrain is out of balance, then we start seeing problems with the cells in the body. But live blood analysis also allows us to choose the best course of treatment. So it does give us a glimpse into the internal cellular environment of our patients. It's a very simple test, minimally invasive. It involves taking a drop of capillary blood from the finger. And based on what we can see there, the most important priorities of the person being tested are immediately obvious. Very useful in that it is a screening test. So the way that the analysis actually occurs is that the analyst would basically look through the working area of the sample, looking at what patterns are immediately obvious. So because we're screening, we're looking for what patterns are there, we basically will see whatever is going on in the system. It's not a case like with conventional blood tests where things could potentially be missed because you've gotten to test for a specific type of issue. With conventional tests, only the things that are indicated on the form are being tested. So there is the possibility to miss important information there. With live blood analysis, we're screening, we're looking at the appearance of the sample, and therefore basically whatever is there, we will see. Somewhat related to the previous point, we're also then able to monitor the efficacy of the sort of treatment protocols being used based on the changes taking place in the blood. So the changes taking place, we can see things going on in real time in the samples. And as soon as changes start taking place in the terrain, we start seeing changes in the blood samples as well. So very useful for us to monitor for improvement and to make changes to the protocol where necessary, at an earlier stage. As practitioners, we have so many choices, and there are many types of different treatment modalities available to us, medicines available, as well as dietary protocols that are available. And often it's quite difficult to work out what is the most appropriate for your patient, and also more so even in chronic conditions where things take a lot longer. So often we don't really see any improvements in the symptoms in the beginning of the treatment because things are shifting in the background. With live blood analysis, we're able to show people during the course of treatment that improvement is actually taking place, even if their symptoms have not really significantly improved yet. So that really helps with patient compliance as well, because often patients tend to hop from practitioner to practitioner. They try something for a month or so and then try something else and keep doing that, and often they don't really get anywhere. So with live blood analysis, we're able to keep them motivated and keep them sort of motivated to follow the program. We can show them that things are actually improving, and that keeps them going, even if their symptoms have not yet improved. That's definitely more applicable with chronic cases, because of the value of live blood analysis and be able to really focus in on the main priorities that need to be worked with the client. Often the improvements are really quite dramatic that we get in our cases. But another big one is just the ability for us to demonstrate the negative effects of an unhealthy diet and lifestyle. And nowadays with information being at our fingertips, practitioners know what constitutes a healthy diet, and most people, or a lot of people, also do. The information is available. The problem is really practically making changes to the diet. People have an emotional connection to food. They often live to eat rather than eat to live, and making those changes really are extremely difficult for people. And that's why often people would agree with whatever you're telling them to do in the consultation, but as soon as they leave your office, they're already starting to kind of justify why they can change some of the recommendations, or not follow some of your advice, especially when it comes to food. So this is really a difficult thing for natural health practitioners to deal with, because healthy diet and lifestyle really is integral to the protocols that we use. There isn't really a pull for a healthy diet if your client is not following the correct diet and lifestyle, if they're putting the wrong sort of things into their bodies, then it doesn't really matter what type of supplements we give them. So them following a healthy diet really is really important, and live blood analysis helps us to motivate people to actually start making those changes. And also when they see the positive changes in their blood when they come back for the follow-up, this reinforces that, and they even more motivated then to continue with those changes in the long term. But to the last point, also an important one, because I noticed this initially when I started practicing. There was a practitioner using live blood analysis in the clinic where I was working with just basic nutritional analysis, but just the dynamic in the practice was very different from what we had. I think there is some background noise at the moment, so I'm just going to mute myself so that we don't have too much noise in the background. And then perhaps if there are any questions, we can take some questions.
Hi, yes, I have a question just for a couple of the attendees that have come in here from all different parts of the world. I think a very important question here is just the accessibility to the education behind what it is that you guys have on offer. A lot of them aren't. I'm fully aware because I've been in correspondence, but the others may not be in full aware as to what it entails. And also just based, because your student alumni are all over the world from my conversation with Rory, and just based upon that experience, what positive effects has it had on not only their business from a fiscal perspective, but also the efficacy of their protocols? What kind of feedback have you guys gotten from other practitioners, and what type of practitioners are you generally in support of?
Yeah, thanks for that, Justin. Yeah, it might be important just to give some background. I'm a qualified homeopath and naturopath, and I'm involved in training practitioners in live blood analysis, and have been involved with it since 2001. We have a training course on live and dry blood analysis available, and this is a course that's been made available as an online course, so it is now available and accessible to anyone who has an internet connection, basically. So we have attendees from all over the world who join in. We run the courses 3 times a year, so there's 3 sort of cycles a year. The course consists of 12 weekly live lessons in a webinar format, supported by online course materials as well. So there's a sort of a user site that attendees then log into to access the course materials, and then the recordings of our live lessons are also then available on the as part of the course materials, so attendees are able to go through the information as many times as needed. I actually started with this training course as more of a traditional type of training course, where we had seminars and so on, and we had a self-study course that I made available. And one of my students from right at the beginning contacted me and actually said that she had gone for a course, sort of a weekend seminar in the US on live blood analysis, and just found that the information was just so much information that it was extremely overwhelming. It is a lot of information to sort of assimilate, and it takes some time. It's not something that one can really grasp just over a weekend. There's a lot of theory and also a big practical aspect to it. Taking blood samples correctly takes a bit of practice, and one needs to follow the correct technique to actually get reliable samples that give you repeatable kind of results. So it is important to get this information in a way that you're able to kind of cover everything. So the online format we found is the best. We have videos on there that cover the practical aspects, so people can look through those as many times as needed, as opposed to looking over someone's shoulder in a seminar kind of setting. In the videos, it's done from the best perspective, so the best sort of opportunity for learning that way. And then also the recorded lesson, also very, very helpful, because practitioners are able to listen to the information as many times as needed.
Just another question, if I may, with regards to another USP that I know dark field can offer, what other conventional tests don't necessarily have the sensitivity of spectrometry to do, is to detect your cell wall deficient bacteria and other forms of pathogens that often come up with a negative status. Meanwhile, as an example of Lyme disease, many are suffering from the symptoms, but are given a negative prognosis. How effective is dark field live blood analysis in being able to detect anomalies of this manner?
Yeah, that's a fantastic question. Thanks, Justin. There's with dark field specifically, we're able to do that because of the high level of magnification and the high level of contrast that we achieve with dark field. Obviously, a proper dark field microscope, we're able to see those really, really fine, faint structures. Our cell wall deficient bacteria obviously are cell wall deficient, so much less reflective than normal bacteria and completely invisible or really, really difficult to see in bright field microscopy. Whereas with dark field, it really comes alive and becomes really very, very easy to see them, provided, of course, that you have a good system. So we have a video here that I can just play as an example of a cell wall deficient bacteria. So this moving, wriggling worm-like structure in the middle of the field of view there, that is actually a cell wall deficient bacteria or L-form bacteria. And the movement there, we can see it really is flexible, and that's obviously not something that's possible if there was a cell wall.
Wow, that's fascinating. Wow, very, very
Yeah,
cool.
so you can really spend so much time, and a lot of people, when they start working with live blood analysis, tend to spend many hours behind the microscope, sort of looking at blood samples and things taking place in the blood. This is another example of a cell wall deficient bacteria, and these things tend to become obvious in samples when the blood cells have been standing on the slide for some time. So, if the sample has been standing, after about 20-30 minutes, it's no longer considered a live sample, and things start changing at quite a rapid rate in the sample after that. So we do look at that sort of rate of change as well, how quickly things start changing as the blood starts breaking down on the slide. And that also tells us about, valuable things about the client's state of health. So, this sort of stressed sample is where a lot of these things are seen, because these cell wall deficient bacteria typically hide inside the red cells. They live inside the cells, where they're, of course, protected from the immune system. They don't have to worry about the white cells chasing them. And, they also have lots of nutritional reserves as well. So really, really ideal for them. And normally, when you're looking at a normal sample, you, of course, won't see them because they're inside the red cells. Only really when we break up the sample, where the cells themselves break up, where we're able to see these structures. All right, so let's go through. We do have a few more minutes, so I'll go through a few of these slides. These are just some examples of clients with existing health conditions that we had in practice, some examples of the images, live blood images before and after treatment, just to show how the condition of the blood sort of ties in with the medical condition. Now, live blood analysis isn't used as a diagnostic tool. We're not able to diagnose a medical condition based on what we're seeing in the blood. So, if we're seeing this picture like we have on the left-hand side, it doesn't necessarily mean that the client has ulcerative colitis. It relates to more broader general type of digestive imbalances. So although it's not a medical diagnostic test, as a medical practitioner, there, of course, will be red flags and, signs that will indicate specific or tie in with specific medical conditions. And in those cases, that really helps the practitioner, helps to narrow down the list of investigations one has to do. But one would still, of course, need to do the conventional specified investigation to make that diagnosis. Right? But the value of live blood analysis really lies in allowing us to see these other imbalances taking place at a cellular level. So the two bright field live blood images there at the top, before and after, showing just the stickiness of the red blood cells, quite severe rouleau on the right hand side, where those red cells overlapping and forming these long chains of overlapping cells, and then the normal picture on the right hand side, where we have no stickiness of the red cells. They are lying on their own, and when they're still settling and moving on the slide, we actually see the red cells just simply sort of slipping past each other, not getting stuck to each other at all. Dark field images at the bottom there showing the fibrin or the fibrin, those white lines, also a significant improvement. So these things, tie in with the case of the case history of the client, their symptoms, and as these symptoms improve, we'll also see these things improving in their blood. Very interesting pattern here, the lower left-hand side, a dry blood sample. This is called a bowel pattern. This actually shows inflammation in the digestive tract. So this would be a very specific sign, something that we would expect to see in a condition like ulcerative colitis. There are some really interesting pictures here. These are bright field images, of course, and live blood of a live blood sample. And the pattern we're looking at there on the left-hand side is just this large group, this gray structure, large group of platelets or thrombocytes that are stuck together. So thrombocytes normally are inactive and they lie on their own. And we can look at the thrombocytes in the image on the right-hand side here. We can see they're far smaller than the red blood cells. These small irregular gray structures here are normal thrombocytes. So when they become activated, they then stick together. And this, of course, is a concern, compared to the size of the red blood cell there, which is also approximately the size of a capillary. This group of thrombocytes is really very, very large, posing a bit of a risk, in terms of thrombosis. So when we see patterns like this, these are warning signs for hypercoagulability and a risk of thrombosis, and definitely things that we monitor then very, very closely in practice to make sure that these patterns, shift. Right. And then the dry blood image on the lower left-hand side there, that's an example of broken fibrin in PPP, which is a blood sugar imbalance sign that we see in dry blood samples. So also another pattern that was monitored in this condition, and we saw it improving as well. Right, top left-hand side there, these red blood cells with these indentations, these really weird, unusual shapes. These are cloud patterns. So these are red blood cells that are just abnormal in shape due to fibrin in the plasma actually pressing into the cells. And this is something we actually can see in dark field. When you change over to dark field, you can see those lines in the plasma. But cloud patterns are linked to inflammation. So basically showing us lots of inflammation in this case. And the green large structure in the bottom image there is uric acid. It says uric acid crystal. So pH is very important in live blood analysis and relates to a lot, many of the anomalies that we work with. And, the balance of the terrain really is dependent on the body's pH remaining in balance as well. So that's also something of great importance in live blood analysis, possible degenerative patterns then. So very important then to monitor those. We see these sort of patterns in the dry blood sample of patients with more serious chronic degenerative conditions, serious conditions like cancer. We also see these patterns along with a few other indicators as well. So very useful, the patterns that we see in dry blood correspond to things that we see in live blood, but often relate to deeper, more long-term sort of patterns, and really, really helpful then and valuable to keep monitoring these things during the course of treatment, because often what we find in practice is that these anomalies that we've seen in the live blood sample tend to clear up quite quickly. After two or 3 months, in many cases, we're able to get their live blood images almost back to normal. But the dry blood patterns take a lot longer to shift because they relate to more deep-seated, a lot more sort of long-term chronic issues in the case. So, to achieve long-term lasting results in our clients, also very important to address the issues that we see in these layers, the dry blood layers as well. Right, now the image at the top on the left-hand side is at lower magnification. The image at the bottom there is then just we've zoomed into one of those white areas, and we're seeing all these other structures within that white area. So this is just something else we looked at in dry blood analysis. When we start seeing these large irregular open areas, often we find crystals and damaged cells and other debris within those areas. The more things we see in there, also the more potentially serious the condition is. And these patterns also, because these things are linked to potential degenerative things, this sort of helps you to work out what type of response you expect to see in your client. Someone who has no degenerative patterns in their dry blood, we would expect the response to be very quick, whereas someone who has many of these degenerative patterns, you know, the protocols would need to be a bit more intensive and the response will be a lot slower as well. I think that actually brings us to the end of the content. So perhaps we can just spend some time then answering a few questions, Justin.
Wonderful. Thank you very much, Doctor. That was highly informative. I personally am looking forward to incorporating it into autonomic coaching's practice. A question I had for Rory, I just want to know with you as well. In instances of collecting the samples, what is the time period in terms of transporting the samples across regions for the viability and actually doing the investigation?
Well, it's a live test. So typically the analysis is done with the patient in the office, and the sample is taken from the patient's finger, you know, when they're there, and analyzed, you know, in front of the patient when they're there as well. When you're taking the sample from the finger, you have about 15 seconds to collect the sample onto the slide, and then about 20 to 30 minutes then to view the live sample. So, you know, it's not really feasible to ship them around and to view them, you know, later on. They really have to be viewed straight away. The dry blood sample, however, once the blood is dried on the slide, it doesn't really change at all, and that can be shipped. Once it's dried, it's also set, so it's not as sensitive as the live sample. You know, nothing really gets damaged if it's moved around. So we do have some groups that do offer this as a service to their clients. You know, to have them take their own dry blood samples, you know, and then to courier those slides to the practitioners, and then those clients then get a report on their findings. It's a great way potentially to get some people into the practice and to sort of get them to become familiar with the technique, but one would still need to get them to come in for more complete analysis thereafter, because, you know, you do need the information from the live sample to kind of tie in with what you're seeing in the dry blood sample.
Of course. And tell me the health parameters that the dry blood spot panels provide. What do they include? Because I'm assuming the detection of pathogens would obviously not be as sensitive as the dark field, as you mentioned a moment ago, in showing that the detectability of, you know, cell wall deficient bacteria, as an example. So what health parameters can one detect from just dry blood analysis?
Yeah, right. Yeah, no, definitely it has its own sort of set of strengths. It's done at very low magnification, so we're not looking at specific cells and so on, but there are many patterns that we can see there. The dry blood analysis was originally called, when it was first developed, it was called the oxidative stress test. So a lot of what we see in the dry blood sample actually relates to oxidative stress. Those white areas that we saw earlier in the dry blood sample are actually caused by the effects of oxidative stress on the tissues. And we understand the mechanism as well. It's quite technical, but research has been done into it, and we understand how those white areas form in a dry blood sample, and it's directly as a result of oxidation. So that's an important sort of element to look at. We firstly look at how much of the blood has been displaced by those white areas, and that gives us an idea of the overall level of oxidative stress. And then we have specific organs that localize in specific areas in the dry blood sample, so we can see stress on, you know, various organ systems. We can see, like in that image with the client with ulcerative colitis, we can see inflammation in specific organ systems. You know, we can see things like heavy metal toxicity patterns and various degenerative type of conditions. Also, interesting, what we see in the dry blood sample is actually parasite indicators. So actual parasites, exogenous parasites like intestinal worms and those sort of things, we don't really tend to see in a live blood sample, because those organisms don't really have a part of their life cycle in the actual blood. And, you know, if you think for yourself, if you have a a parasite, actual parasitic worm, intestinal worm in a single drop of peripheral blood, the client's going to be extremely unwell. So it's not really feasible. We don't really see that in
Yeah,
normal,
God forbid.
absolutely. So and if you think of how many drops of blood is actually in the human body, it would be quite frightening, So what we see in the dry blood sample actually indicators for patterns related to intestinal parasites. So very useful for us there as well, because often we see signs, and we've had it quite a few times in practice, where you see signs of toxicity and you see the client has, high levels of toxicity, but they're following a relatively healthy diet. There's not much there that could be contributing to toxicity. But we look at the dry blood sample, we then see high levels of parasites, and then following an anti-parasite protocol with those clients, we then get great results with them as well.
That's really insightful. And I was going to ask, in that you mentioned about the oxidative stress, are you able to have an approximation as to what type of reactive oxygen species might be inducing the oxidative stress? What I mean by that is, can you deduce if it's from a predominant lipid peroxidative process, or is it just from poor respiratory chain dynamics in the mitochondria? Are you able to, I know the specificity as to how you can do that is obviously going to be broad, given the nature of, integrative or should we say alternative medicine, but nonetheless, would you have a good approximation as to what type of radical is actually inducing the oxidative damage?
Unfortunately not. No, this is the one of the limitations then with live blood analysis, is because it is visual, we sort of limited in the finer details that we're able to get. So we can see signs, for example, of vitamin B12 deficiency, but we can't say, your B12 level is this. And the same with iron. If we're seeing mineral deficiencies, we can see it's mineral deficiencies, but we're not really able to say it's this specific mineral that's deficient. The same with metals as well. So it's an indicator, and extremely helpful in many cases. Often in most cases in practice, there is no need for further tests. But depending on your scope of practice and how you work with your clients, you may need to do further tests then to establish, if you want to know the type of oxidative species involved.
Thank you. That's very clear. I think it's a great, definitely a great initial diagnostic point, and also a great real-time follow-up diagnostic point. That's not nowhere near as invasive or time-consuming or costly as a lot of the other diagnostics are. I've got a friend of ours here, also a fellow colleague, Catherine Watkins. I know that she's doing something else whilst listening to this, so I hope she can answer the question. But she was actually following somebody that was doing some research into the vaccine and the damage that it was creating in the body. And the person actually was cited your name in their research as well. Could you elaborate and just fill us in as to the unique perspectives that dark field or live blood analysis can provide in those who may be experiencing long haul COVID or vaccinated damage, if possible?
Yeah, no, absolutely, for sure. We have a number of practitioners who have been working in this sort of field, have been working with their patients after COVID and after the vaccine, and have observed specific patterns. So we've put together information from these practitioners on what they've observed. We have an update on this as a separate module now with our training course. So it is available for attendees that join. They will have access to this information. But yeah, it's again, because it is such a niche type of technique, not many people are doing it. Dark field isn't really done in laboratories. So, a lot of the patterns that are there were completely missed because people just didn't see what was actually going on. But practitioners working with our microscopes, they're quite specialized dark field microscopes. We've have them built specifically for us according to our own specifications, just to allow us to see everything that you should be able to see in dark field. So with those microscopes, these attendees have been able to see these things and have started working on this and have done research. And we have specific patterns that have been identified. And there's a lot of information, and there's a lot of evidence. So really, it's really concerning. And every day, almost you hear about someone who has had some complication. The only thing that it can be related to is the vaccine.
I'm most certainly grateful that you guys are bringing your contribution to the table. I know that Dr. Patterson's also made some good headway in his research as well, to trying to bring some insurance cover to people that are being affected by this. So hopefully in the collaboration amongst other medical professionals, we can bring more light to getting those who've really been negatively impacted by this some medical cover of disability somewhere, somehow. That might be wishful thinking, but we got to keep trying, don't we?
Absolutely, yeah. It would be great if there is something, because of course the pharmaceutical companies are completely not liable. So there's no recourse there.
No, unfortunately not. I'm going to open up the floor, if that's okay with you, Doctor, to the other members, if they have any questions. But I, for one, just want to say thank you very much for the insight. And again, truly looking forward to attending the syllabus next year. So thank you.
Wonderful, thank you.
Amanda, if you'd like to ask your question, you're most welcome to unmute and ask your question. I think you've typed a few messages in the group, so if you'd like to ask anything, please feel free. And that goes for anybody else that's listening. If you guys would like to ask a question, by all means, this is the moment to do so.
Hi guys. Hi doctor. I just was interested in my own journey in terms of I've been dealing with chronic Lyme, and it was quite an interesting discovery for me in my kind of scramble for like finding a practitioner that can actually treat it, that it couldn't be seen on live blood analysis. I just wondered, in terms of dark field analysis, you may have already said this, but is it actually, can you detect Lyme disease through the dark field?
Well, yes, there are specific patterns that we see, and although they, again, are not diagnostic of Lyme's disease, we can see, cell wall deficient bacteria, and those are often linked to Lyme disease. So, depending on the case picture, we often just work with the sort of case history and work on an index of suspicion based on what we're seeing. And often that's how it's sort of, how one would work out that Lyme is the actual issue. But in cases that I've had with Lyme disease, we see lots of those cell wall deficient bacteria. So definitely something that can be, we can work out whether that is the issue, and also we can then look at those patterns during the course of treatment to see that it is actually improving.
Okay. I mean, that's interesting. And the reason why I'm mentioning it is because I felt, as a patient, sort of searching like desperately for solutions, it's important to know that a normal live blood analysis would not give you an indication of Lyme disease.
Yes, that's maybe just an important point. It is important to make sure that the practitioner is using a proper dark field microscope with a high level of magnification. Unfortunately, also, now with the internet, if you search for a dark field microscope, you can find them online, and they're really, really cheap. Unfortunately, if you then look at the actual specifications, they don't have the necessary specs to allow you to see everything in the blood. So we spend a lot of time in the course also going through the details on that, what sort of things to look for, and to make sure that your microscope is up for the job. If it isn't a proper dark field microscope, then you also won't be able to see it. The microscopes that don't have the correct specifications for dark field show you pretty much the same as what you're able to see in bright field.
And you are South African, obviously, with a surname like Botha.
Yes, I'm based in Johannesburg, and then I have a partner who hosts the course on the training side, and she's based in the UK. And then also on the health product side, I work with Dr. Rory John Jacques, who formulates our health products for us. And those products were actually formulated working with live blood analysis, looking at those indicators and things that we look at in the sample to actually see that we're getting the results that we should be getting with the formulations.
Okay. And then I also had another sort of comment in a way about the vaccines. I've been following Dr. Anna Mahalcha, and she's been talking about sort of nanotechnology that's like creating, sort of what could you call it, like nanotech that's forming on its own within the blood. I don't know have you seen anything like that based on vaccine results or whatever, the nanotech?
Yes, I have. I've actually been following her work as well. She's one of our past attendees, and she uses one of our microscopes. So she was able to sort of see these things,
Okay.
and she has a large following as well, and lots of people read her content. Unfortunately, it also has created a lot of confusion. So a lot of people are looking at artifacts, things that are just air bubbles or just fibers that made their way into the sample, and relating it to vaccine related challenges. But that is also what we've done with the latest module, is to sort of define very clearly what this key features are that you should be seeing if it is in fact vaccine related. So those patterns that Dr. Anna identified, were not just static. They actually developed into specific things, while the sample was sitting on the slide. So that has been included into the training, and to allow people to identify those things correctly and not get alarmed about things that are just artifacts.
So on the whole, have you done treatments with her recommendations, like the vitamin C and the chelation protocols and stuff like that?
Yeah, we have practitioners that use her protocols. I don't work with patients in practice actively because I'm full-time involved with the training and with the equipment as well. But many of our practitioners who have completed the training also follow and have worked with her protocols. A lot of it is based on intravenous. The sort of basis of her main approach is intravenous chelation, which of course has its benefits, but there are also risks. So very important, if one has those types of treatments, to also be monitored closely. We specifically look at mineral levels, as a result of those treatments, so we monitor those quite closely, and we're able to do that obviously with dry blood analysis. But practitioners using chelation may have other techniques that they use to monitor those levels.
All right, thank you very much.
You're welcome. Thank you.
Thank you.
I just wanted to have everybody confirm, or just to confirm what you mentioned to everybody around the microscopes, and that your facility actually helps to produce or organizes the production, at least, of the microscopes to meet the right specifications to have accurate sample identification. And that's also part of your course structure, in terms of you can purchase the course fee alongside the microscope as a bundle. Would you mind just running us through like what the different options are around that, in terms of the different microscopes and what have you, if you don't mind, if it's not too, because I don't want to infringe on any.
No, not at all. Not at all. No, I'm happy to discuss that. We do have the microscope manufactured for us. So we have a manufacturer that has been producing microscopes for sort of medical applications for over 30 years now, actually. And they produce the microscopes according to our own specifications. Previously, way back when I started working with live blood analysis, when I was training in live blood analysis, they were using Olympus microscopes, but Olympus is a lot of those objectives and parts that were used previously in dark field microscopy are no longer available from Olympus, because it's such a niche application that it's not really feasible for them to obviously produce it. So we've had to go to someone and actually give them a list of specifications and get them to produce it according to those specifications, which also means that other dark field microscopes often don't have exactly the right combination. The ones that are sold online usually don't have the right light source, which allows you to see almost nothing in dark field. And then, there's lots of other things to look at as well. So quite important. And it's important to get that right. If you don't have the right specifications, it's quite difficult. It's can be a cause for sleepless nights if you have to wonder about the things that you might have seen in the sample that were there, but just were not visible because of your microscope. So very important to do that. And so yeah, the microscopes are produced for us. I'm a little bit of a perfectionist with these things. So I actually test and set up the microscopes myself before they are sent out for dark field. Again, because dark field is quite specific, so we need to make sure that all the settings are 100% right so that when the person unpacks the microscopes and start using it, they don't have to set anything up, so yeah, I do that before it's sent off, and we ship to all destinations. Basically, the prices that you'll find on the website there, at the address on the screen, include international shipping as well.
Sonia, just for that mention, if we can just get that website and all that information ready for when we do release this recording as well, so people can immediately go to the website and find out more. I have another question. Sorry, I've got many questions. This is more of a spiritual, metaphysical question. It's probably a bit of a random one. But, the work that the scientist, is a Japanese guy, Masaru Emoto, did on water and the impact that emotion has on water states. Have you ever thought, well, I don't know if you have or you haven't, but I know Rory is as much of a hippie scientist as what I am, so he may have done so. But have you ever thought to look into the psychological or the spirit, whatever practice a person may be doing to improve their self-image, and the impact that alone has on live blood analysis?
Yeah, that's a fascinating field and an area for lots of interesting research. I'm sure that lots can be done there. Some has already been done, and we do know that negative thoughts and negative sort of thinking patterns do have an effect on the terrain, a direct effect. It has an acidic effect on the system, so it makes the body more acidic. And all the positive sort of thoughts and positive affirmations and those sort of things help to improve alkalinity in the system. So there's definitely a part of what we have to bear in mind when working with our clients. Of course, we know the effects of stress. They're well documented, and stress has a direct effect on many different parts of the body. So those sort of things are really, really important. But it would be interesting to sort of start looking at how samples change simply based on what patients are thinking, rather than what they're taking.
I think in particular for even like new re-emerging scientific tools like psychedelic medicines that are now obviously finding their way back into medical research. We're really interested to see. I know they're obviously doing other survey on amino acid profiles, neurotransmitter profiles, and obviously psychoanalysis surveys as well, which are more qualitative as basis. But really to see a quantitative perspective utilizing dark field in their application as well.
What's fantastic with this technique is that whatever has a positive effect on the system will be obvious in a blood sample, so we can actually test whether things are effective or not, and that's how we've also developed our product range, is actually by looking at those things. So it's a very useful tool to kind of test those types of things, to see how things are impacting on one's health, and any modality that you're making use of that is effective and actually has a positive effect on the system will integrate very well with live blood analysis. So a lot of people that work with things like detoxification clinics, people that work with weight loss programs, personal training, anything that helps to optimize health, it really is helpful. We've often also found people that work with more subtle type of treatments, homeopathic treatments, biofeedback, those types of things. Also, live blood is really useful as an addition there, because it just gives people something visual and kind of more practical in a sense that they can relate to.
Absolutely. And I love that point you made about determining the efficacy of treatment, regardless if it's a detoxification process or, as I mentioned before, a psychedelic medicine. They can be deemed as being positive, but each person is an individual. And something seemingly healthy can actually become very destructive if it's not monitored. And again, as you mentioned when you started, conventional labs only look for certain parameters of enzymatic reactions, but they're looking at the reactions. They're looking at the factors creating the reactions, not necessarily the actual live reactions. And that's where you really find out the magic of what is or what isn't happening. Obviously I don't practice this as of yet, but this is where we utilize other diagnostic tools like stool and urine from organic acids to get more of an accurate indication rather than just, your conventional serum blood chemistry. So I truly appreciate that comment there. I think it's highly valid.
Yeah, thanks so much. Yeah, and it does bear out in practice as well. Similarly, people come in and they on a specific diet because it worked for a friend of theirs, and when we actually look at their blood, we can see that it is not appropriate at all for them. So often people do that. They don't really have any other way of gauging these things. So something that might have worked for someone else, they would try and see if it works for them. Whereas with live blood analysis, we don't have to question. We just have to look at what is there and work according to that.
Does anybody else have anything else they would like to add? I mean, I'm just having I'm having a field day here. Your mind is a wonderful treat. So thank you. But if anybody else has anything else they'd like to ask, please feel free. No? All right. I think, Doctor, thank you so much for your time. I have no doubt that when we release this video to the public, there will be questions as well. And if we have your permission just to forward those questions over to you, we'd be really appreciative just to help the community become more acquainted with this form of diagnostic. So thank you very much for your presentation and the knowledge that you have bestowed upon us.
Thanks so much for the time. Thanks, Justin.